and Quinnipiac Chamber of Commerce. Very pleased to have everyone with us today for a special presentation, COVID-19 and mental health 1 year later, how to deal with the new normal, whatever that is. We'll dive into that a little bit as well. This is our councils and conversations. We call it C Squared. This used to be in person. We look forward to, maybe as soon as next month, if not July or August, getting back together with councils and conversations in person. This event is a little bit different than what we do for our normal webinars. Normally a webinar, we cannot see the participants, we only can see the panelists, but we try to make this more interactive since that's what C Squared is all about, getting people together and providing networking opportunities. So what we'll do today is we'll start off with our speakers. We'll let them talk and we'll go till about 8:45. And then at that point, we will break off of the conversation and we'll go into breakout rooms. Everyone will be randomly assigned and just a great opportunity to network online. And then as Ray was mentioning, we have a networking business after hours this evening. So there may be a few spots still left. If you're interested in that, you can get in touch with Ray. All right, well, today's presentation is brought to you by the Healthcare and Life Sciences Council. But before we get to that, we want to thank all of our investors who are with us, our premier investors, key investors, and principal investors. All of the companies on your screen are a huge support to the Chamber and everything that we are able to do, especially coming out of the pandemic and moving forward. And they've been with us, many of them, for so many years. And as I was starting to say, today's presentation is brought to you by the Healthcare and Life Sciences Council. That's presented by Harvard Pilgrim Healthcare. Also, our Human Resource Council, presented by Carmody, and our Nonprofit Resource Council, presented by Whittlesey. What we've tried to do over the last several months is bring together the councils to find topics that really cut across multiple spectrums. And so I think as you hear today, you're going to see how this really is important to not only healthcare, but human resources and nonprofit as well. Before we get started, I want to welcome in Shannon Duncanson. She's a sales executive with Harvard Pilgrim Healthcare and the sponsor of our Healthcare and Life Sciences Council. Shannon?
Thank you, Garrett. As the only not-for-profit health insurance carrier here in Connecticut, Harvard Pilgrim Healthcare is proud of its partnership with the Greater New Haven Chamber of Commerce. At Harvard Pilgrim, we continually look for ways to strengthen the communities in which we all live. As such, today we are part of today's event to discuss how to deal with the new normal. This is an exciting topic, I think, for all of us today as we figure out how to adventure this next year. I would like to thank our panelists today for also joining us today to discuss this important topic. So thank you once again, and I look forward to our panelists in hearing what they have to say. Thank you, Garrett.
Great, thanks, Shannon, and thank you to Harvard Pilgrim for your support. So now we're going to get into our topic, and just a reminder for everyone, we record these sessions. They're all available on our YouTube page. Please go there and subscribe so you can see them. We've done close to 70 since the pandemic started, different webinars. Hopefully serve as a great resource tool for anyone in business. And our topic today, COVID-19 and mental health 1 year later, how to deal with the new normal. Now we'll introduce our panelists, and I'll start by introducing Alice Forrester. She's the Chief Executive with Clifford Beers Guidance Clinic. Jarrell Gallman, he's the Executive Director of Retreat Behavioral Health. And Javi Alvarado, Director of Social Work with Yale New Haven Health System. I'm going to start off with Alice. We had some great discussions beforehand, but Alice, why don't you start us off with just some thoughts on this topic. When we talked about a week ago, we were just talking about the significant change that's going on in everyone's lives and so much stress that people have been dealing with and continue to deal with, at least for the last year or so. Alice?
Thank you, Garrett. It's very nice to be here. And Shannon, we're a Harvard Pilgrim family at Clifford Beer. So here's a plug and true. Clifford Beers is a child guidance mental health agency for adults and children, families, and we work very closely with the community. And as soon as we were notified that we had to move. We were able to move our organization to a telemedicine model really within about 72 hours, I think. Of course, that came with a lot of complications on our client side because many families were left without really the right devices to be able to connect. And we had to do a lot of partnering with New Haven Public Schools to make sure that Chromebooks and video conferencing materials were available for our families. Soon after that, the mayor asked Clifford Beers to conduct a mental health sort of response meeting with the community to figure out what we might need during this time. And we held a meeting, and I had the opportunity of speaking to a few crisis health people. One woman who was working in the Ebola crisis in Sierra Leone. And she gave us some very good advice. And she said, really what you want more than anything is to keep the communications going, create some forms of streams of communication. And so we started a warm line, we called it, for New Haven, which was answered by our folks who would normally be sitting at the desks, our client service representatives. And so we've taken well over 1,000 calls over this last year. We expanded to across the state and wanted to just be able to provide relationships with people. And so so folks call back, they use the line sometimes often. Some folks just call for information. We have a resource page that thousands of people have used. But that was such an important information for us in terms of this crisis, is keeping connected and related with people. We made that effort within our organization with our staff, and we made that effort within the community. And I think that is going to be our advice and our for the new normal, is relationships matter. Connections with people matter, and managing, keeping connected with folks, whether it's outside or on Zoom. To be honest with you, our families, many of our families, with the right equipment, found telemedicine the better solution. It was simpler and easier for people. So I think that the new normal is about what we've learned from this crisis, what we can bring forward, how do we stay connected, and how do we stay in relationship, be it virtual or in person or hybrid, and creating community, within our neighborhoods, our families, and making sure that people feel not disenfranchised or isolated or alone. So for me, the new normal is connection, and a focus on connection, which maybe in our old, the old normal was a little less important because we had so much to do. Now you only can do your work if you're connected. So that's my first swap at that question.
Gary. Thanks, Alice. And we'll come back and speak with you as we continue along. Want to turn to Jarrell now. And Jarrell, we're talking about a significant spike that we've seen in substance abuse as the pandemic has gone on. Tell us a little bit about the experience at Retreat Behavioral Health and how people are coping and how to deal with the substance abuse spike as well.
Good morning, everyone, and thank you, Mr. Sheehan, our panelists, and our viewers today. My name is Jarrell Gallman. I'm with Retreat Behavioral Health as the Executive Director. And thank you for having me for this topic today as we discuss this new normal. I think, as we all know, this is not a new normal for those suffering with mental health or substance use. This pandemic has been going on a long time for those suffering. And through this year, as Dr. Forrester mentioned, it has been an interesting transition with telehealth and virtual health. So as we begin to open up our society, our country, and transition back to in-person, I think that will be a good benefit for those needing that actual physical support, in-person support, while we continue to use telehealth as well. Retreat Behavioral Health is on L.T. Grasso Boulevard. We are new to the community, considering we opened just prior to the pandemic last year in February. So this certainly has been a challenging year. I need to take a moment just to thank our staff and your staff and all of us who have worked through this pandemic. There wouldn't be a today if we didn't have those individuals. Our first responders, our teachers, our hospitals, all of these people, as I mentioned, aforementioned, with suffering from mental health, behavioral health, and medical issues, certainly have thrived through this with the help of all of us and others. So again, emphasis on thanking our staff and others today. Retreat is a resource to the community as many of our staff and individuals begin to transition into the workplace. I think it's important that over the course of this next time that we define a new normal, the next year or so, that we keep in mind those that have been working on the front lines. Because now we have other industry workers or other workers that's going to be transitioning back into the office, that those that have already been there. And I think that in itself could be stressful. Because while we have had meetings just like we're doing here today on Zoom, now we're all going to be integrated back into the same workplace. And what does that look like? How do we structure the day? How do we structure treatment? Do we utilize hybrid approaches via telehealth and in person? And I think ultimately giving support to those that are transitioning back and those that have already been in the workforce is going to be critical, that us as healthcare workers, we're able to support those of need. And I think that's where the resource comes in and the collaboration comes in, as Dr. Forrester mentioned earlier, is all of our resources collaborating together, because those resources are critical, because I don't even believe we've seen the ultimate fallout of what we're talking about. Mental health has increased. We've seen increased admissions. We've seen an increased need for services overall. So we will continue that process. Mr. Sheehan, thank you for having me today, and thank you to the Chamber for having us today. Look forward to the conversation.
Great, thanks, Jarrell, and we'll be back with you as well. And before I turn to Javi, just want to let everyone know you can put your questions into the chat. We'll start taking questions in just a few moments as we get more into the discussion. You can also raise your hand, use the hand raising on Zoom, or if you kind of raise your hand, I'll try to identify you. You can ask your question directly in person. And Javi, this last month has been a strange one. No matter where people fall on kind of their feelings about COVID, the change to losing masks has been a little bit jarring. It just happened really quickly, and society changed. There's a lot of cross currents going on, and I know that has lots of different impacts on people as to whether they feel comfortable going back into the workplace, just how they feel about COVID. Some people feeling that, some people take it too far, some people don't take it seriously enough, creating lots of issues. What are some of the things that you've been seeing, and how does all that play out with people's mental behavior?
Thank you, Garrett, and hello, everyone. Thank you for having me. Really nice to be here. Before I get started, I just wanted to report, we get a daily report on the number of COVID positive folks who are inpatient in the hospital, and the number of ICU cases and folks that are on mechanical ventilation. And today we heard that we have 33 folks who are patients who are COVID positive, 14 in the ICU and 7 who are ventilated. And I believe I heard about 120 or so across the state. So very, the lowest numbers we've experienced over the last year. So we're happy to see that. But clearly, as Jarrell was saying, there's still an impact in our communities when it comes to the COVID-19 pandemic. So a lot has happened over the last year as the rate of infections and hospitalizations slow down. Some towns and cities and states are starting to slowly reopen business, public areas, new guidelines on masks. I think one of the important things for me, and the way that we talk about the pandemic here is to acknowledge the impact over the last year, and how it's impacted ourselves, our frontline care workers, our families and patients. We've had millions of people who have been unemployed, who've lost their businesses, suffered losses, or business has suffered losses. Children, as I'm sure Dr. Forrester is very familiar with, have experienced challenges at their schools, shutting down, introduced with new ways of interacting with each other, lots of less touching, more social distancing, and the impact that's had on kids. I think we're just starting to realize that, what that is and what that new normal might be for those children. We have in many ways learned to process and cope with the pandemic and its impact. But again, in order to move forward, sometimes we have to acknowledge what has happened and how that's impacted our families, find ways to talk about the last year, to express our feelings and concerns, the loss of family members and neighbors. We also know that there's been a disproportionate number of deaths in communities of color, in Black, Latino, Native American communities. And all of these our lived experiences have to be acknowledged before we can move into the new normal.
Okay, thanks, Javi. And now we'll open it up for all of our panelists to talk. And again, if you have questions, and I'll make sure that I'm looking at everyone, just raise your hand and we'll let you ask your question. I'll just start throwing this out to the entire panel, and I think Javi started to touch upon this as well. Really, it's been an uneven experience from the pandemic for everyone. Some people who lost multiple family members, some people who lost jobs, some people who did better in the pandemic, frankly. They were able to work from home, maybe some school districts that were open, some that were closed. So I guess, how do we navigate this where people may not be willing to talk about their issues just because they see life getting back to normal, and they think maybe their neighbors didn't have any issues, maybe their friends didn't have any issues while they dealt with a lot of issues. How should people navigate this landscape? And I'll throw it out, Alice, if you want to start us off, and any of the other panelists that want to jump in on that question.
Sure. In New Haven Public Schools ran a very important social emotional support day for staff and families probably a few months ago. It was quite a powerful experience for me, where I held space for talking about grief with families and within individuals and staff. And the thing that was so blatantly clear is that it's not the deaths of people and their relatives was very important, but the grief that people have suffered this year alone, car accidents, breast cancer, loss of not seeing family members for a very long time, parents, taking care of elderly parents, just, through distant care, just being alone or losing a parent. The amount of experiences that Javi, I think, sort of indicated right around, it's so important to talk about what happened to you during these months, and holding space for that is also a critical factor. And to be honest with you, as an agency that focuses very strongly on trauma and adversity, we find that the natural inclination for folks is to actually avoid conversations like that because they're painful. And I think what happens then, as Jarrell mentioned, is, the high levels of stress and coping mechanisms, be it substance use or other coping strategies that don't work, become the way, rather than, having simple and very open conversations around what your experience has been. And I think, providing those spaces within our community, within our workplaces, is going to be a critical factor. In particular for us is with our children in the classrooms. We do a lot of work in New Haven, whole classroom work, educating kids about certain topics around mental health as an early intervention and prevention model, but I think we really have to up that and find enough folks to be able to be in the communities, to be in the schools, creating conversations around grief and loss. And, after those groups that we ran, very, 2 1-hour sessions, I feel incredibly connected to those folks. I may never see them again, but the reality was the amount of powerful exchange that happened amongst a group of strangers, I think had meaning for people, and they realized that they weren't alone. So I think that we're going to have to really create spaces for both people who are identified, who are living with mental health issues. And, I know that we've seen a gigantic increase in our emergency mobile crisis work, and folks seeking services, but also in the people who are not yet reporting their distress. And there might be a way with it. We might be able to actually intervene quicker and faster if we do preventative work and hold preventative conversations.
Jarrell or Javi, anything you want to add to that? And I guess maybe the other piece I'll add in is, the amount of people that we have on unemployment that happened very suddenly. There was an understanding over the last year as the virus continued to spread that wouldn't change very quickly. But now there are jobs available. People are starting to go back to work, but people have hesitations about that. And not all the same jobs that were there before are still in existence. So it's not just a easy go back to your old job for everyone. And so people are facing a lot of challenges in getting back into the workforce. And interested to know if you're starting to see issues around that are popping up.
But I could add that, here at the hospital, our folks, the Department of Social Work, which is about over 200 across the health system, initially started to work rotational, so some remote work as well as on the ground patient-facing work. But then very soon after the pandemic got started, 100% of our social workers were on the ground working with patients. And we quickly realized that we had a very captive audience to talk about well-being sorts of issues and to create the kind of space that Dr. Forrester was talking about. Every opportunity you had, whether it was a staff meeting or other unit meetings, we led with a focus on well-being. And that was really important, balancing work and life, being a lot more flexible than we have in the past. Concerned about the productivity, but at the same time, very focused on well-being. Each opportunity we had to talk about whether it was depression, anxiety, or the stressors that they were facing was an opportunity to destigmatize mental health. And we found that to be one of the most important things we can do, create an opportunity for folks to access resources, to talk about resources. And I think that a lot of employers are in a unique opportunity to continue to do this kind of work. As we return to the new normal, whether it's bringing resources to their employees, having resources available in break rooms to talk about, or have speakers come to their place of employment. And now with Zoom, we can do this pretty easily. And there's so many resources out there in our towns and the state that are willing to talk about their resources and create greater access to those resources. So I think that's really important.
Thanks, Javi. Go ahead, Jarrell.
Yeah, Javi, I think, and thank you for mentioning that, the idea around taking care of yourself and self-care and emotional and mental well-being is so important as it pertains to our workforce and our individuals of the community that may be struggling. I think now more than ever, the words "be kind to others" is certainly applicable. Because we don't know what individuals are going through. I certainly think of the single mothers and single fathers who are entering back into the workforce, but their kids may need to come home because they have a sniff or a cough or elevated temperature. because safety is ultimately so important still in this new normal. But now I'm trying to navigate going back into the workforce and our kids having to be in school. I think about those individuals who haven't been able to see their family for some time and may have been in congregate care in an elderly facility, or now I need to figure out how to make time for my family and balance work. So all of these things, and we can go on as far as those struggles that might be presenting the community. But now more than ever, just be kind to each other is certainly applicable. I also think that there should be a lot of resource and conversation, and thus the chamber has created these forums where we are given resources, because those transitioning back into the workforce, it's not going to be an easy path for some. There's a large population of individuals that are searching for jobs and applying for the same jobs. And that in itself could just be crushing for many. It takes time. And I think ultimately for those listening today, be patient with the process, seek resources early, both on the outpatient level of care and inpatient level of care. But those on the outpatient level of care, you're able to have that emotional support to be able to talk about those stressors that may be presenting yourself before things get to the breaking point for you, because it is going to be an uphill battle for many that are searching for jobs.
You both touched upon it a little bit, and maybe we'll take a little bit deeper dive. Employers right now, it's a strange time for them. I think many are feeling pressure to kind of reopen the office, get people back in. At the same time, as Javi was just saying, employees are in different places. Any lessons learned, thoughts on what employers should do? They're trying to figure out that new normal. Are their employees part-time remote, part-time in person? I did hear being flexible from all three of you is a key part of it. But I'll let you just kind of expound on that, because I think anyone who's in a management or leading a business is trying to figure this out and trying to figure out the best way to be productive, but also get their employees back into the facility. Alice, you want to start there?
Yeah, I think this is, a problem that we're all sharing, as we did sharing with COVID. We as mental health and health providers have to be in person for many of our services. We've been, as Javi said, on the ground really very quickly after COVID, especially our emergency mobile crisis folks, our psychological testing people, our early childhood and in-home doorstep, door knocking, connection in the community. I think we're going to face a justice issue. Javi said productivity, as a mental health provider, right? We count our clinical work by their productivity. They have to see X amount of face-to-faces, be it telemedicine or in person. And also then, finding a critical decision point of how do you decide if a person is going to go telehealth? Is this the right model or service for a family? So there's a lot of complicated in the actual work itself. But then, the stress of coming back. I have two kids who are reclusive and homeschooled and hating hybrid, and so want to remain at home. And managing getting them up and ready and trying to get them into school is problematic when I'm running a multi-million-dollar organization. So it's just the very stress of that is very real. And I've read every article the Journal or Wall Street Journal or the Times has put out around, how do you create that flexible workspace? And not everybody's productivity can be counted in a widget way. So, there's a lot of work that has to be done around thinking about business and organizations. We closed two of our offices. So we closed our administrative offices and are building out new ones. So I have a little bit of a delay in terms of getting the administrators back. They're we're all doing fine, working from home right now. But I think when that space is completed building, we're going to start feeling the pressure of like, where is that person? I think also having a realistic hybrid model, meaning if someone's on Zoom and someone's in person, how do you not have an inequity there? And I know Google has designed these really cool circle spaces with, TV person, well, that's great for Google nonprofits, if we're lucky we have one TV. So it's, how do you create that equality within the workspace is going to be very important, and flexibility. And I think HR conversations are going to be the top in the next few months. How do you do that? And how do you make the evaluations? And the chambers are going to be very, very important and helpful in those areas.
Jarrell and Javi, I know you both touched on this a little bit. Anything you want to add?
Yes, please. I think of the mask, and when we're talking about returning to work and a hybrid model, we are a hospital facility, so we have maintained the mask. I walked in the store yesterday, and interestingly, I was one of few still wearing a mask at that location. And it was an interesting feeling for me to feel as that kind of outlying person still wearing a mask. And as we think about transitioning back into the workforce and where we go from there, I would also caution, and I'm interested in your thoughts, Javi, just being safe during this time. I think society is so anxious to get out and about. The weather's beautiful. Memorial Day is upon us, July 4th, the beaches are open, and our safety is just so critical through this new normal, this process, that we follow our professionals, our experts as it pertains to their recommendations, that we are still talking about getting vaccinated, that we are still talking about workplace safety, and we just don't go back full force into back to what we known as the normal before, of course, unless that's our professional saying it. So thank you for that question, because it's critical that we are considering our employee safety, our patient safety, and our family safety as it pertains to this transition to a new normal.
I would just, add to, what I've heard Jarrell saying and Alice talk about is that these safety concerns have to be prioritized. And, it's when we talk with our folks, we talk about complacency, right? And we all fall into that, especially as Jarrell was saying, as the summer months approach and we've been cooped up for the last year, there's this great need to just get out there and transition to this new normal that we keep talking about. I just want to underscore one really important point, and I think both Jarrell and Alice had talked about this, and that's the importance of human relationships. We have, over the last year, I spent a lot of time together, 8 to 12 hours a day here in the hospital, sometimes more. And that's a lot of time that you're spending with your colleagues, and enhancing those relationships, we realize is a protective factor when it comes to ongoing stress that we're going to continue to experience. Is COVID isn't quite over. It's still here with us. We're just learning to live with it. But those human relationships, the quality of those relationships, we found to be very important. And again, as we talk about productivity and working with patients, we also have to balance that with the well-being of our employees, and ensuring that they take leave time when they have it, allowing them as many breaks and opportunities to unwind or connect and support each other. So, as an employer, as a leader here at the hospital, we lead again with well-being and again balancing work and life.
And again, if anyone has any questions in the audience, feel free to jump in and ask them. You can just raise your hand or put them in the chat and I can read it off. I guess one last question from me, and that's for individuals, anyone who's dealing with issues or knows someone who is, what would you recommend? What's the best pathway for them to seek out help and start to get help? And Javi, maybe I'll start with you, and then we'll go through Terrell and Alice as well.
Sure. Again, if folks are feeling destabilized, if there's distress out there, I think one of the things that we try to do is just help folks understand that this was a normal response to a very stressful event. We here at Yale instituted a buddy program, pairing up of two individuals, similar roles, and they would exchange their phone number and contact information, and they would check in on each other throughout the day on such issues as how are they sleeping, what is their diet like, are they exercising, how are things in your family, those kinds of check. And then we talk to them about some potential red flags. What would someone who is distressed, what would they what are the characteristics, what would they look like, what are the warning signs, and then reach out to the proper intervention to refer them to, whether it's our EAP or EFR as it's called here, or outside community mental health services. So the buddy program has been really successful. We all believe that we're caring for all of employees, but when it comes to the buddy program, we know that for certain there's at least one person that's going to be checking in on you throughout the work week and into the weekends as well. So that we've also conducted some employee well-being check-ins, so offering each of our healthcare workers a drop-in time, a 30-minute, whether it was face-to-face or on the phone, sort of review some of the stressors that they may have experienced. And at one point, it was looking at some of the Ptsd sorts of criteria, talking to them about how they're coping with those issues, and then also sharing with them some positive coping mechanisms. But the first thing was to normalize their response to all of this, and then to provide easy access to mental health services. Each time, as I said earlier, each time that we talk about this topic, it makes it easier for people to access services. There are folks who sometimes are feeling depressed, for instance, who feel that they're all alone. And when they hear that other people as well are distressed or stressed out or anxious or depressed, that helps them access and connect with resources.
Thanks, Javi. Terrell and Alice, and also there was a comment here too about noticing the signs of PTSD.
Yeah, I'll jump in there. So we've been talking and we see the numbers as it pertains to suicide certainly increasing. And I think it would be remiss if we just didn't give a moment to speak about some of the resources available for the community. Certainly the National Suicide Prevention Hotline is available. There are resources to recover. There's a resource line. And then there's the 211 of Connecticut for individuals to reference should there be a need for that. If you are feeling lonely, someone to connect to. And then Retreat Behavioral Health, we have a 24-hour admissions team that if you don't admit to our program, we will help and connect to different resources in the community. And as I mentioned earlier, those resources as it pertains to the professionals in the workforce are so important. So I have built some relationships just through this forum, and I'm looking to connect with different individuals so that we can continue to grow stronger in the greater New Haven community. As it pertains to our employees, and we talked about it earlier, I think that in that time for, we call it PTO, time off. And we have some really strong workers who have outright refused to take PTO because of their dedications to our individuals of need. And As a leader of the organization, it has taken some mandating of leaving early to spend time with family or spend time with others. I've participated in quite a few of these forums, and I always find myself, it's important that each one of us reach out to someone today. I have a couple individuals of mine who I have kind of not reached out to for some time, and I need to. And that will be both helpful for that individual who may not be reaching out for their help, and also helpful for us as professionals of taking time to make those connections with individuals that are important to us. I'm not talking about our individuals we speak to every day, but that individual who just been meaning to reach out to and connect with. If all of us on this call take time to do that today, we may be reaching out to someone who is really struggling. So thank you for that.
Great, thanks, Jarrell. And Alice, I'll leave you with the last word for this morning.
Well, Jarrell, I met you on this call and I'm very excited to have that. And I do have your phone number. So I'm going to reach out to you just to connect and get to know you more. Welcome to New Haven. I think that, Jarrell really talked about it. I think the question around post-traumatic stress disorder, I think there's a couple of things that I just want to say always before we begin to talk about post-traumatic stress disorder or PTSD. First is, within the first year or so of an event, anything is normal, right? It's not diagnosable as PTSD, but that if you're feeling depressed, you feel like your bed is your favorite place to be, or anxiety, all of these are normal feelings. And I think someone said it earlier, normalizing the unnormal feelings, right? If you see a repeated pattern of behavior, in particular with our children, that is so different than their normal activities, it might be time to kind of break up their schedule, break up what they're doing, so that they have more sunlight, that they have more activity, physical activity, more connection with people. Because I think, we can get complacent, as someone said earlier. So, post-traumatic stress disorder looks differently in a lot of people. In particular, in children, it looks very different in each kid. You may have a child who's behaviorally anxious, acting out, aggressive, or you may have a kid who's just sort of disassociating, sort of back in the corner, being very quiet, not really saying much, and withdrawn. So you have to really understand what are the triggers and also what are the events that have happened for this child. If you have a loving connection, as Jarrell said, one person, I loved having what you said. I wish I could go back and do the buddy system, Clifford Beers, because just one person really cuts through everything and you can actually feel like you're not alone. So I think that, PTSD is also, even when we worked in our Sandy Hook work, many kids had experienced other very bad things before the event, right? And so really looking at the length of adversity, the amount of adversity people have experienced. Well, I believe, and I don't want to be, going on, but I think we've had more than one pandemic. Our social justice awareness has just, blossomed during this time. Certainly yesterday's anniversary of, it's not an anniversary, the day that George Floyd was murdered, really has brought all of us to a place of really understanding that things have to change. The new normal is not just wearing masks and social distancing and, virtual hybrid learning. The new normal is really looking at justice and how our community, how injustice showed up in our community, in unemployment, in the folks who had to work. I was never more grateful for the Stop and Shop workers when the COVID first started. I mean, I really was like, thank you so much for coming to work. that was so important to us to be able to have those resources. So looking at, I hope the new normal includes a new understanding of what our justice and what people in our community mean to each other. So.
Thank you, Alice. And thank you, Jarrell and Javi as well. It's been a very important and great conversation that we've had this morning. So appreciate you spending some time with us. And we don't want everyone to, don't run off. We're going to do breakout rooms in just a moment. Did just want to let everyone know, and speaking of how people get back in person, back to the new normal, we do have our first couple of big events coming up. June 10th, our annual meeting for the Quinnipiac Chamber of Commerce. That will be in person. You go on to our website there to register. And then on June 15th, our real estate and construction forecast. We'll be having an online program and then meeting up at 3 of our brewery locations in the region for in-person networking. So slowly getting back there. But again, thank you to all of our councils, especially Healthcare and Life Science Council and our panelists for this morning. And now we're going to switch to breakout rooms. We are going to randomly assign you to one of those rooms. Again, this is just a great opportunity to talk and connect with folks. So just give us a moment and you will be placed into one of those rooms. Thanks again, everyone. We will end from the breakout room, so we won't be coming back here to the main session. Thanks.
Thank you.